I developed an eating disorder my freshman year.
I also developed my eating disorder, the brunt of it, my freshman year. I left school my spring semester of my freshman year to go to treatment.
My eating disorder really stemmed from when I was 11 until I was 17 when I went into a treatment facility.
I think one of the most noteworthy things about having an eating disorder in college is that it's really hard because no one really understands it or talks about it.
Definitely at first it's a lot of anger or it's just kind of like, oh no, it's fine, that's not what's going on. You do not have to be a certain weight to have an eating disorder because you have a mental disease, not because of how your body is.
I knew I wasn't happy and I knew that there was something not right, but I didn't think that my obsessions with my appearance were particularly abnormal. And I think a lot of that is because we live in this bubble of college where like a lot of those behaviors are in a way normal.
So when I came into college, I was a year and a half in recovery, and I didn't really know how it was going to affect me. When I came in, I was really nervous.
Like when you go to the gym, you hear people vowing about, oh, I'm going to have a flat stomach by May, and when you go to the dining hall, you hear people talking about their plates and how healthy or unhealthy their meals are and how much weight they've gained since high school, that kind of thing. There's just like a lot of components of the college environment that make it really difficult.
So it was like this whole new world where no one knew and I could kind of get away with it more. So I was kind of nervous, but it ended up being not as bad as I thought it was going to be.
Well, I think it's important to also talk about like the resources and the ways to go about recovery in the college atmosphere.
If you are in a place where you can trust someone to like tell them if you're struggling or not.
One big thing for me has been being open.
I think it takes a lot of trust and a lot of relationship building to get to that point.
Just because if you tell the people who are around you that you're struggling, you're going to build a bigger support system and people will understand and be compassionate.
So learning how to be honest with not only the people in my life, but also with myself about how I'm doing was like really important and really hard.
My sophomore year, I remember a friend just put a pamphlet on my desk, and I came back to my room and I was like, are you serious? Like, what is this? And I just like threw it in the trash. So sometimes like a honest conversation is better than just like slapping a pamphlet around.
If you're at the dining hall and like saying something in front of others, like it can make someone feel attacked or called out. Doing it in a private, comfortable place is often most productive.
For me, I noticed that when people were just honest with me about how they felt and how I was making them feel, that's when I got the most out of it and when the message was more powerful for me.
I guess you have to get to a point where you can accept their words and like understand that it's because they care about you, not because like they're blaming you for something.
And it's still a struggle, and so I don't want to send the message that any of us are all better or we're cured or anything, that it's like a work in progress. That's the reality, and that gave me a lot of hope.
I've met so many girls through my course of recovery who are like, if I'm always going to have to deal with it, then what's the point? And all I say is my worst day recovered is better than my best day using behaviors.
The resources at UNH are so helpful. That's actually what got me into treatment, is using the resources at health services.
Don't be ashamed to ask for help because that makes you strong, not weak. And I really hope that if you know someone who's struggling, or if you're struggling, please reach out to someone. It doesn't have to be us. We would love that. But if you don't feel comfortable, reach out to someone, tell someone close to you so they can help you get to where you need to be.